Hi, potential investors. My name is Jason McClendon, and I'm here to speak to you today about Coach Clinic, the offering that we have to the market, and how we're hoping to improve um, not only healthcare in communities, but also improve operating efficiencies and revenue stream potential for healthcare providers and healthcare networks. So I first want to start off with a bit of an example slash story. I think we can all probably relate to a time where we've been sick, a loved one of ours has been sick, and required possibly urgent care. Something, one way or the other, led you there. And we went to the emergency room, and first thing to do is almost take a number, right? Get in line, possibly fill out some forms. And then do you go straight in? Absolutely not. We're all taking a seat, right? Probably depending on the judgment of the person at the window, whether you're actually bleeding or not is going to dictate how quickly you're going to be seen by a medical professional, as well as the congestion, the number of people there. So I know it's a little bit of comical relief, but if you've ever been to an ER room, you can probably agree that there is a spectrum of individuals that are there for various reasons. Some are a little more urgent than others. And either way, it still creates quite a bit of people and sharing one room and seeking one service. So, with that, a lot of research that we've seen is a lot of providers report the same, right? They have a lot of challenges with congested ER rooms, extended waiting times, people waiting for care. And in some cases, they almost have to turn people away, especially if they're en route, to other hospitals, depending on what their bandwidth is able to support at that moment. So essentially, this creates a bit of an issue because people are ultimately just waiting to receive care, and some are in dire need of it. So hopefully that example helps paint a bit of context here, but I want to dive into an introduction that speaks a little bit to the issue at a 30,000 foot view. So nationally, we've approximately 136 million emergency room visits. That roughly gives us a market of about $18 billion. What we're proposing with Coach Clinic is a way to help capture some of that market opportunity and also do some good by alleviating some of the ER visits and keeping people that perhaps only need more preventative care receiving it from a different method. Our research also showed that about 27% of those visits might fall into that spectrum of those not needing immediate care, but are seeking out emergency rooms because that is their most viable option. Mobile healthcare clinic is marketed as a white label mobile healthcare clinic as a service model designed to help healthcare providers, healthcare networks, individual hospitals, in some cases community clinics, have broader presence and serve areas that have traditionally been underserved. It'll help them diversify revenue streams that they've not been previously able to tap into. And for those that are growing, it'll allow them a sustainable and responsible way to scale their business without incurring the administrative overhead, upfront costs, etc. So really diving down into our value prop, what we bring to healthcare providers is a white label service all up. That's equipment, logistics, marketing and outreach support as well, all branded underneath the healthcare provider's current name, slogan, culture, brand, playbook, everything, right? Essentially, as far as the public or the community is concerned, this product will be their own. It'll be first party, right? In that way, it again allows them to do what they do best, and that is providing the best staff and best care that they can at any contact point that they have with their customers, whether it be in the hospital or mobile health care clinic. As far as administration, building, maintenance, anything like that that has to go with the vehicle, that's all managed by Coach Clinic under our master services contract with the healthcare provider. Again, our goal is to help our clients be legend at serving their communities from the healthcare perspective, especially preventative care, and alleviating those ER rooms as part of the process. And the mobile healthcare clinic as a service is a fantastic option for most providers, and we believe it delivers immense value, which we'll dive into. So, sorry, I'm going to move this over here for a second. I know there's a lot of text here on this slide, but I'll give you the highlights. We've chosen the Seattle area as our entry point. Why? The place has grown. If you live in the area, you absolutely can see that exponential growth has occurred here. Quick numbers, since 2010, almost 20%, right? One of the fastest growing cities in the US. Vis-a-vis, there's an increased need for healthcare across the board, not just within the city, but in the greater Seattle area as well. Circling back to the revenue aspect, right? In 2009, almost $80 billion in revenue generated from ER visits alone. High margins within the operating room, especially if they have healthcare, almost 22%. Industry standard, I mean, you go to any other industry, that's pretty solid operating margin. One other piece there is what we brought up before. Those ER visits that are not actually urgent in nature can end up costing the hospital from multiple perspectives, right? They may or may not actually have coverage for that level of care from the ER, depending on what their symptoms are, things like that. They might not have healthcare insurance at all. So because they can't be refused treatment, they end up eating a lot of those costs. And again, circling back to our earlier conversation, a lot of these individuals don't have any other alternative. This is their primary means of care, depending on the area where they live and where they actually acquire healthcare. So with almost an average of probably about 15 to 20% of those visits not actually being real emergencies, they are congesting that ER room unnecessarily for other patients that could either be receiving care faster and are going to be more profitable for that emergency room. So again, in terms of the market, we're really, as a white label provider, able to help these healthcare organizations maximize their profits while adding better customer service and care to their other customers that are in urgent need. We've also found the things that really drive a value proposition for healthcare organizations and hospitals. Number one, hospitals are seeking value. I think, as I've spoken to earlier, we deliver immense value from multiple angles with the mobile healthcare clinic as a service model, right? There's very little administrative burden. They don't have to carry a cost on their books, being that everything is managed through an MSA with the mobile health care clinic and Coach Clinic. They also are, again, less price sensitive and more focused on investments that improve processes, quality, efficiencies that can be realized anywhere, right? And, aligning with strategic initiatives like serving their community, being a good steward in their community, having positive brand sentiment within their community, right? Being a provider of choice. Those are all really important things, all things that Coach Clinic helps deliver with our mobile healthcare clinic white label model. Again, this also allows us to capture nice margins on the mobile healthcare clinic MSAs that we have with healthcare providers, being that, while price is always important, as long as you're meeting the key priorities in the hierarchy, such as value and delivering on showing tangible, ROI, and quality efficiency, and the other key elements that hospitals are looking for, they are less price sensitive and willing to pay for services and products that deliver value to them. In terms of our financials, we originally started with a $250,000 investment from our founders. We have a couple of contracts and sales opportunities in the pipeline that we're expecting will pan out in Q2 of 2020. I provided a distribution of a pro forma income statement here. In a nutshell, we're expecting a bit of a loss between years 1 to 2, and expect that we will be profitable coming into about year 3. This will certainly require quite a bit of work, expansion out of the Seattle market, all of which is in the appendix of our proposed business plan. So, getting right to it, we are seeking an initial investment of $3 million to help us sift through our first year of operation, with a follow-up Series B review at the conclusion of year 2 of $750,000. In return, Coach Clinic is offering a 20% equity stake in consideration of both rounds of those funding opportunities. Looking forward into our income statement and ledger, we are forecasted to be valued at approximately $12 million in year 4. Estimated equity at that time would be about $2.4 million. So we're expecting a break even at some point for an investment of that 20% equity share, approximately between year 4 and 5, but hopefully sooner. So in conclusion, Coach Clinic's white label mobile healthcare clinic as a service is a fantastic way for healthcare organizations to meet their strategic objectives, increase efficiency across the board in terms of processes, eliminating wait times, eliminating congestion in the ER, and still maintaining cohesiveness with their brand in the community. The real takeaway is it's a win-win for everybody, right? Patients end up getting better care, access to preventative care, and being able to choose where they need to, where they want to go based on the urgency of their need. And healthcare providers have less congested ERs and are seeing a better profitability and revenue streams from all of that. I thank everyone for their time and look forward to answering any follow-up questions.